our data shows 1 in 6 patients will get a pressure injury in our system.
Wounds themselves are a huge issue for patients and providers. They're very costly. It can turn something that should be a shorter hospital stay into a really complex and long-term stay, and potentially a life-altering injury.
NanoTess is a Canadian social enterprise creating new frontiers of opportunities through catalytic innovations. We have a vision to end the silent pandemic of wounds and improve skin health around the world.
NanoTess is the perfect example of a Canadian entrepreneur recognizing a gap in the healthcare system and stepping up to the plate to fill it. It's through these commercialization projects that the company gets access to the AHS clinicians, resources, data, and a guided opportunity to improve the product in a real-life environment.
The goal of the CanHealth funding wasn't necessarily to prove that NanoTess worked. We had some of that early data, but we were really wanting to understand, is it feasible? Will people use it? And what does that kind of clinical care pathway look like more in the real world? And based on the results, they found a roughly 46% decrease in cost by using NanoSelv instead of the traditional standard of care dressings.
They were able to close wounds about 56% faster than our traditional products in our toolkit that we would use today. So that's pretty impressive.
I really want to say thank you, because I truly believe that in 10 years from now, it's opportunities that have been created through this partnering with CanHealth, with Alberta Health Services Innovation Team, with all of these critical stakeholder partners. But looking back and 10 years from now thinking, CanHealth was the spark. And that this is what's going to get us to that next chapter and build this Canadian technology within Canada that we can expand globally to support the rest of the world.